Hi everyone, welcome back to my channel. Now in today's video, we are going to look at how this 100-year-old vaccine, BCG vaccine, could potentially help prevent COVID-19 or help patients with COVID-19. If you are new to my channel, I'm Dr. Han. I love to produce review videos on online courses, sharing information on health and science, and I also like to share learning tips and tricks for students' personal and academic development. If these are your interested topic and you haven't subscribed yet, please hit the button down below. Now, in today's video, we are going to look at one study that published in early July 2020, looking at the correlation between BCG vaccine and COVID mortality in different countries, and look at the informations, what their outcomes, their limitations, and as well as what is the follow-up on this BCG vaccine topic. Now, without further talking, let's go to the screen. Alright guys, now in this video we are going to look at what we know about the BCG vaccine in related to COVID-19 and what we don't know about it, and based on a study published earlier in July 2020, and what are we going to do about this BCG vaccine currently and in the near future. So as always, this video is my summary and interpretation of publicly available scientific information, and this video does not serve as any intention to make advice in regarding to diagnosis, treatment, and preventions of any diseases. If I mention any commercial company, I have no ties in with those at all. Alright, so what is BCG vaccine? Now, BCG vaccine is actually a 100-year-old vaccine. It was first given to human in 1921. It was developed by French scientist and veterinarian based on a attenuated strain of bacteria called bovine tuberculosis bacillus. Okay, so it is closely related to the TB bacteria, Mycobacterium tuberculosis. So the purpose was for this vaccine was to prevent the infections for tuberculosis. Okay, now this vaccine is still being given in many countries currently, especially in places where TB is still prevalent and relevant as well. So what we see in this vaccine is that it actually can confer some type of an enhanced innate immunity for people that had that vaccine. This vaccine is kind of special. A lot of the time, these vaccines can leave a scar at the injection site, as you see in this picture. So there is a very recent observation published in a study looking at a correlation between countries with the BCG policy and the death from COVID-19. Now, this research was led by a researcher affiliated with the US National Institution of Health, or NIH. So here is a graphical data presented by the researcher in the study. Now, first of all, we can look at the upper panel showing the death report before May. Okay, so this data was actually collected before May, and the more red the color, the more the death. Now, we all know that currently the US has the most death resulted from COVID-19, and here is a data showing you the BCG policy. Now, those deep blue color is the country that are still administering BCG to all infants when they're at birth, and those light blue one means they used to administer these vaccine, but now currently they stopped it. And here US, there has never been a BCG policy mandate for infants. Now, so here we are looking at a newer data I collected from Johns Hopkins University, their COVID-19 website. Now, here this graph shows a normalized value, i.e. a case fatality ratio, okay, looking at how many cases versus how many deaths. Now, this data already is showing a little bit different patterns than the previous one. Now, notice that in places like in Mexico, even though they mandated with the BCG vaccines there is still a very high case fatality ratio compared to US. That brings to the limitation of the study that I'm currently talking about. Now, before we talked about the limitation, let's look at the special case that happened in Germany. Now, Germany, it was divided into Western and Eastern before 1990. So they had different policy on the BCG vaccines. Actually, the West Germany infants were given the vaccines a little bit later, between 1961 to 1998, compared to Eastern Germany. Infants were given with the vaccines between 1951 to 1975. So there is a age differences in the populations in regarding to when they are getting the BCG vaccine. Now currently they have stopped doing this already. Now with this special case, you can look at the population locally. Now those that had the BCG vaccine, the estimated age, okay, in the western side of the country, they are between 20 to 60 years old, and in the eastern side of the country that we're looking at a little bit older, okay, between 80 to 40 some years old. Now with that in mind, and looking at the mortality rate between the two sides of the country, it appears that people that had the vaccine, even though they are older, okay, the mortality rate, it looks like it's lower in the eastern side of the country compared to the western side. So that has some indicative value that this does provide some helpfulness for older people in the country. But this study have a lot of limitations, such as influenced by social and economic and demographic differences between the country. Now, countries that can provide better healthcare, the chances of death or the rate of death is theoretically is lower than the countries that cannot provide such care. All right, so without looking at these values, these data are not as valid. So the researcher do a filtered analysis, okay, try to match the populations, the population density, the economical values of the development of the country, and try to do the analysis that way. So it comes down to they were only analyzing 22 countries with these filtered analysis. The correlations are there, but again, there need to be more direct evidence to say, hey, this BCG vaccine could potentially help with preventing death in COVID-19 patients. So that was their conclusion. So what is going on right now? So after these observations, people started to wonder, what can we do, okay, in terms of having a more solid conclusions on this BCG vaccine. Now currently many places such as in Denmark, USA, France, and Australia, there are ongoing clinical trial looking at how BCG vaccine could protect healthcare workers from contracting this COVID-19. And in India, just very recently, they started their trial looking at how this BCG vaccine could reduce mortality and morbidity in elderly patients 60 years old or above. Now, both studies are going to go for at least 6 months, so we're not going to get any immediate data at this point. So what is the take-home message? Now, here we presented a study showed some correlation between having the BCG vaccines and lower COVID-19 mortality rate. And currently, the WHO statement stating that this BCG vaccine does not or have no evidence to show it prevent COVID-19. So that is their statement, and there are couple trials going on happening in the world to look at how this vaccine could help, and these studies will last for about 6 months. So we will stay tuned in the near future to see if there are indeed any concrete evidence showing the benefit. Alright, again, to learn more, there are the clinical trials that are listed in clinicaltrial.gov websites, and also the paper that I referenced for today's presentations. And I'll put all those links in the description box down below. If you learned something new from today's video, please give me a thumbs up and a like, and feel free to leave comments down below so that we can have a discussion on the topic. Now that's all for this week, and I'll see you again next time. Bye.